Hello, everybody. This is Gary. Today is Monday, July 13th, 2020. It is 5:29 p.m. Eastern Standard Time in the USA in Rochester, New York. And this is just a quick update on coping with schizophrenia. Um, I'm doing okay. Not a lot of whole bad symptoms today. My hallucinations, my paranoia, my suspicion, my anxiety and depression, hallucinations seem to be under control. To some extent, they're always there, but I'm doing pretty well. Um, Things will slowly start getting back to normal when it comes to my medical appointments and my psychiatry appointments. I have a primary care appointment with my nurse practitioner on the 21st of July at 1:20 p.m. It will be my first in-person visit with her or any other primary care doctor in about 4 months. I've been doing, like a lot of people, medical appointments either by video or telephone calls. So things are going to start getting back to normal. I mean, it's true for everybody that some things will be in person, other things will be over the telephone as the economy and society tries to choose when and how to open up. Um, but my clinic thinks it's safe enough for me to come in person, which is important because I have to be physically present at my primary care provider in order for them to take my vital signs, do a physical exam, that sort of thing. There's only so much you can do by teleconferencing or by telephone. Um, the last time somebody took my vital signs and gave me a physical exam was a few days ago, last week, when I went to the emergency room for severe constipation. They had to give me an enema. They had to give me blood tests. They had to give me a chest x-ray and an abdominal x-ray to make sure that it wasn't something more serious than just constipation. Um, so I got a complete physical workup only because I went to the emergency room. And the emergency room is not supposed to be the first place you go for physical medical care unless it's actually needed. Um, I'm a smoker, so one of the things I'm always interested in is what's called my oxygen saturation in my blood. My oxygen saturation tells me how much oxygen I'm getting from just everyday normal breathing. My oxygen saturation levels are about 95%, which is normal. So, despite the fact that I smoke more than a pack of cigarettes a day, I'm still apparently getting enough normal oxygen in my blood, which is a good thing. But I also want to quit smoking before that blood oxygen saturation starts to drop permanently. Um, so I'm going in to see my primary care nurse practitioner on the 21st. They'll give me an exam, they'll ask me questions, we'll go over my medications, both psychiatric and medical. Um, the emergency room put me on 2 laxatives to prevent constipation and the need to go to the emergency room. And this is one of the legitimate criticisms of psychiatry. You take a pill for something, for say Seroquel for manic depression. Well, the Seroquel has a side effect of making you gain weight, so you eat more. And so you take another pill to help you lose weight, because the first pill makes you gain weight. You take an appetite suppressant to suppress your desire to eat, because you're overeating because of the Seroquel. The problem with psychiatry is you take a bunch of pills that cause a bunch of side effects. Then you have to take a bunch of pills for those side effects. And that's exactly is what's happening with me. I'm on several different psychiatric medications, a couple of antipsychotics, an antidepressant, a couple of medications for anxiety, and all of them can cause constipation. Severe constipation, where you have to go into the emergency room. And so they had to add 2 laxatives for me to take every day indefinitely so that I don't go to the emergency room again for constipation. And also, I have an in person appointment with my psychiatrist on June 30th. It's a new psychiatrist. I have not met him physically yet in person. We did have a consultation over the telephone a week or so ago. But like I said, things are starting to slowly get back to normal at the clinic I go to. So it's going to be an in person visit with this psychiatrist, which is important because he is my new psychiatrist. And it's important that I physically meet him in person so we could have a real conversation. So that's starting to slowly go back to normal. I haven't seen a psychiatrist in person outside the psychiatric emergency room in about 4 months. And I go to the same clinic for my primary care as well as my psychiatric care. And they're starting to reopen. They're starting to do in person visits again. Um, and so things are slowly getting back to normal as far as my medical and psychiatric treatment appointments go. Um, Medications really haven't changed all that much. Um, a month or so ago, they put me back on Klonopin, but a very restricted regimen. I'm only allowed 6 tablets every 2 weeks, and each tablet is a half a milligram of Klonopin. The reason being obvious that Klonopin is physically and mentally addictive, but it has certain benefits when it's used under restricted circumstances. It helps keep me out of the psychiatric emergency room, and I'm not taking enough of it to be physically addicted to it or to be mentally dependent on it. There are other ways for me to deal with anxiety other than Klonopin. I also take hydroxyzine for anxiety. Hydroxyzine is an antihistamine usually used for severe allergic reactions and hives and itching and that kind of thing. But it also has anti anxiety properties. So I take the hydroxyzine 3 times a day. It is not physically addictive. It is not the same class of drugs as Klonopin. There's no physical and mental dependence on it. It doesn't cause severe withdrawal symptoms if you go off of hydroxyzine because it's not physically addictive. It's not like alcohol. It's not like Klonopin. It's not like Xanax and Ativan and Valium and all the rest. So that's pretty much it. Things are getting back to the normal. Um, just trying to stay busy, trying to keep my day structured. Having a list of things to do every day helps me feel normal. And in many ways, I think that's what we all want. We just want normal to come back again. And it is, however slowly it is. Um, I haven't got much to complain about. I have a place to live, I have money to pay my bills, I have things to do to keep me busy. So there's not much I can complain about. I know there are a lot of people in worse situations than mine, especially economically. They've lost their jobs, their businesses, their income. and that in itself can cause mental health problems. So I wish the best for everybody. I'm doing okay. Like, comment, share, subscribe. Press the notification bell when you want to be notified that I put out a new video. If you want to help my channel, share these videos on Facebook, Twitter, and other social media. I don't ask for money to do these videos because I really don't need to. But like I said, if you want to help my channel out, share my videos. And that's pretty much it for now. If you have any ideas for a video you want me to do on a particular topic, let me know in the comments section. It could be about mental health, it could be about something else. I'll talk to you later.